Hello everyone and welcome to TubulesLive. This is of course the very first TubulesLive of 2015 and very privileged to have with us today Dr. Alan SIDI. Dr. SIDI, welcome to the show.
Thank you.
Today your talk is on sinus augmentation, but before we dive into that, I think for everyone in the live audience and the folks at home, we'd like to know a little bit more about you. So can you tell us a little bit about yourself, where you work and your areas of interest?
So my main areas of interest are periodontics and implant surgery. I run a referral practice dedicated to those two topics. I also teach at Guy's Hospital Dental School on the postgraduate course in periodontics for one session a week.
Brilliant. And the other thing I'd like to ask is your talk today on sinus augmentation. What are you hoping to cover for everyone and who is it suitable for?
Well, I've tried to direct it at two groups, if you like. For those who don't know very much about sinus augmentation surgery, it's an introduction and try and cover the scope of what it can do. And for those who perhaps know more about it and are even practicing this procedure, I'd just like to share some tips and some techniques that I've gathered over the past 20-odd years I've been carrying out this procedure.
So it's for the budding periodontists and implantologists, and already those who are established who can perhaps gain some tips from you today.
That's right.
Great. Well, I'll leave you to part one, and I'll join you back at part two. Okay, Dr. SIDI.
Thanks very much. Well, welcome to this evening and for the introduction, and I'd like to thank Drew Shah for inviting me here this evening to speak about maxillary sinus augmentation surgery for dental implants. As I mentioned, the objectives of this evening's talk is to look at two aspects. One, general introduction, and secondly, to share with you some surgical and technical tips. The content of the talk is to cover naturally the anatomy, physiology, and a little bit the pathology of this technique. It's important we look at these because they have some ramifications on the surgery that's performed afterwards. In terms of the technique, we're going to look at all the different aspects involved with the technique, indications, contraindications, investigations, and so on. Why do we need to do maxillary sinus augmentation surgery? Well, quite simply, when you have tooth loss, you have bone loss that follows. And in the maxilla, the bone loss that follows is much more rapid and more significant than in the mandible. And indeed, when we find ourselves in situations like this where we have failing teeth or teeth that have been lost and we want to place an implant to replace these teeth, then we will inevitably come up against the maxillary sinus, and this needs to be addressed. So if we want to be implantologists, then we really have to do something about maxillary sinus surgery, either find someone to refer to or learn the techniques ourselves. What this talk won't do, it's not an ABC and how to do maxillary augmentation sinus surgery. I don't expect anyone to go out tomorrow morning and start doing it. If you want to learn how to do this technique, then you really need to go on a good hands-on course, and there are a number that are about at the moment, and learn to do it properly. So this is really just an introduction and for information. One point I'd like to make is that sinus augmentation surgery is not the only option for the treatment of missing teeth in the posterior maxilla. There are a number of other alternatives, including block grafts, zygomatic implants, pterygoid implants, angled implants, and so on. And it really depends on the situation and on the patient. However, for example, this is a case where I used an angled implant to avoid the sinus as the patient was medically compromised, and we wanted to make the surgery as straightforward as possible. One of the problems with this kind of approach is that it does make hygiene difficult in this area. And here's another case that was referred to me. The patient had swelling and pain and problems around this angled implant, and you can see once we raised the flap how much bone loss was present. Anything that makes hygiene more difficult is going to predispose the patient to peri-implantitis. And of course, you can get peri-implantitis around straight implants too, but if you're going to make the thing more difficult for the patient, then they're going to be more susceptible to it. So maxillary sinus augmentation surgery, one of the most common surgical procedures carried out, and one of the reasons why is that it is so predictable. It really works very well, provided the technique is followed carefully. The maxillary sinus isn't on its own. It forms part of a group of sinuses the frontal and the ethmoid, and also the sphenoid sinus, which you can't see in this section as it's behind. The point about this group of sinuses is that they are all connected together. And this is relevant surgically, because if you develop an infection in one, it can travel across the others and create further problems. Sorry about that. In terms of the sinus itself, the sinus starts very small. And it grows. And really the most significant factor in the growth of the sinus of its size is really to do with the eruption of teeth and the development of teeth, and also followed by the loss of teeth. So if we have a look at this DPT, this is about an 8 or 9-year-old, and we can see that the sinuses here are really quite small. And if we compare and contrast this to a 50-year-old who's lost their maxillary molars, we can see that the sinus has expanded very significantly. And if we want to place implants here to replace these missing teeth, then this needs to be addressed. In terms of anatomy, the maxillary sinus is described as a 4-sided pyramid. The base of that pyramid forms the wall between the sinus itself and the nasal cavity. The sinuses vary tremendously in size, in height between 3.5 to 4.5 centimeters, in width between 2.5 and 3.5 centimeters, and also they vary quite significantly in depth and volume as well. In terms of